new infections, of which are about 140 daily. And they're happening now, even as we are talking. They are happening because there are some Ugandans who are not on ARVs.
Dr. Stephen Watiti is among the 1.4 million Ugandans that are living with HIV and AIDS in the country. His focus is on helping others come to terms with their status and promote awareness of the scourge. As a country, we have taken various strides in this fight against HIV and AIDS since the first patient tested positive in Rakai district in the early 1980s.
HIV prevalence was high at 18% in the general population. It is now at 6.8% for women and 4.2% for men, 2.8% among young women, and 1.1% among young men.
Uganda has been recognized globally as a frontrunner in reducing new HIV infections. However, according to the 2019 findings, the new HIV infections were higher among females, but more deaths were registered among males.
51,000 new infections which occurred in 2019. And as you know, we still have a significant burden of those new infections occurring in young people, the population between 15 and 24. We have more women living with HIV compared to men. When it comes to AIDS-related death, that flips. And we are seeing more men dying from AIDS. Almost 60% of the 19,000 people who died from AIDS in 2019 were men.
Currently, there is no data on the 2020 figures. In April, NTV aired a story on a 28-year-old Gonzaga Sentongo, a resident of Katabi Town Council in Wakiso district, who was cycling nearly 22 kilometers to Mildmay Hospital in Lueza to pick up antiretroviral drugs for people living with HIV and AIDS in his community during the lockdown.
They are sick. They have no way out, however much they are not affected with a coronavirus.
How did COVID impact on people living with HIV? And we will know the exact numbers because we do, work out the numbers, working with the Ministry of Health at the end of every year. So once the year has ended, this data will be analyzed.
The World Health Organization and UNAIDS estimated that a 6-month disruption of antiretroviral therapy due to the COVID-19 pandemic could lead to more than 500,000 extra deaths from AIDS-related illnesses in sub-Saharan Africa in 2020 to 2021. Rita Kanya, NTV.